Hello everyone, this is Dr. Shawn Pourgol. I'm an osteopath, and today I want to speak to you about how chiropractic, naprapathy, and the manual therapy part of physiotherapy, which is also known as physical therapy in the US, has originated from the profession of osteopathy. Osteopathy is like a grandfather of all manual therapy techniques, health professions that provide hands-on manual therapy techniques in US. Think of it like Kung Fu that Taekwondo and Karate has originated from, something similar in that line. Before any other system of organized manual therapy techniques founded, osteopathy was there. However, all manual therapy techniques date back to thousands of years, and they've been practiced in Europe, Asia, and elsewhere for centuries. But Dr. Andrew Steele, founder of osteopathy, he worked for 20 years in Shawnee tribes reservation land in the US as a medical doctor, as their physician. Unfortunately, 3 of his children passed away due to meningitis, and this hit him very hard because he was a medical doctor, yet he couldn't save his own children. And he got disillusioned by medicine, and he got exposed to how Shawnee tribes and Cherokee tribes, they treated their own people. He got exposed to their bodywork and healing arts, and he collected the physical techniques such as manipulations of the viscera, the body, and so on. And he said he got this idea from God to present it as an organized system of medicine called osteopathy, as an organized system of healthcare called osteopathy. Initially, it started as a hands-on manual therapy technique. Later on, it added prescription, surgery, and so on, and became exactly similar as medicine. So in US, the profession of osteopathy is exactly the same as medicine. However, in Europe and the rest of the world, the profession of manual osteopathy, which just uses hands to provide treatments without using surgery and medication, is used. So practice of osteopathic medicine is only in the US, while manual osteopathy is practiced elsewhere. However, even in US, there are a lot of manual osteopaths, osteopathic manual practitioners working here. I founded in 2016 National University of Medical Sciences in Naples, Florida, which is the only school offering manual osteopathic education in the US. After osteopathy was founded, Dr. David Palmer, founder of Chiropractic Healthcare, he registered in the first school of osteopathy to study osteopathy under Dr. Steele. He was planning to open an osteopathic college, but he and Dr. Steele did not get along. He didn't get permission, and he got upset. Without finishing his school, he left the osteopathy program. He focused on spinal manipulation. Osteopathy techniques includes spinal manipulation, but also includes a lot of gentle, repetitive techniques, non-force techniques. But Dr. Palmer, founder of chiropractic, removed those techniques, focused mainly on spinal manipulation, also changed the philosophy of osteopathy, but it kept the 4 tenets of osteopathy, the 4 philosophical aspects of osteopathy. But instead of what osteopaths focus on blood flow, Dr. Palmer put more emphasis on nerves and nerve flow and how nerves control the body. And he created that profession, and he used even the terms like subluxation and adjustment. These are the terms that were used by osteopaths before chiropractic was founded. However, after chiropractors started using these terms, Dr. Steele stopped using these terms as to not confuse the two professions. So instead of subluxation, they used lesion. They called it what it was, osteopathic lesions, and instead of adjustments, they use the term manipulation. And chiropractic went on around the world and after that and grew a lot and became its own profession. Next, the profession of naprapathy, which is not naturopathy, even though many people read it as naturopathy. Is naprapathy is a system of healthcare that focuses on connective tissue. It was founded by Dr. Oakley Smith, which studied osteopathy, chiropractic, and medicine. And Dr. Smith first worked with Dr. Palmer and started teaching in Dr. Palmer's chiropractic college. Later on, they set up a clinic and they worked together. One time he traveled to Czechoslovakia and got exposed to their manual system called Naprapathy, and it affected him. He came and he started doing a lot of research on connective tissues, and he found that the idea of the subluxation, which at that time was the base of chiropractic healthcare, which is a bone out of a place, a vertebrae out of place, he found that not acceptable and instead focused on connective tissue. By the way, that theory of chiropractic is no longer in use. They do not believe subluxation as being out of place, a bone out of place any longer. But at that time, over 100 years ago, he didn't believe in that theory, so he and Dr. Palmer didn't get along after that, and he separated and used chiropractic, osteopathy, and his medical knowledge and made the system called naprapathy, which basically means to fix disorders, and chiropractic means basically to the treatment by hand, and that's how the profession of naprapathy was formed. The profession of physiotherapy, which as is known in most of the countries in the world, and in the US it is called physical therapy, that profession initially did not use manual hands-on therapy. There were some physiotherapists in France who also studied osteopathy, and these French osteopaths introduced the manual therapy to physiotherapy. So all the physiotherapy, manual therapy techniques that you see, they are all osteopathic technique. For example, muscle energy techniques that we use in osteopathy, these physiotherapists took that, changed the name, and called it PNF, proprioceptive neuromuscular facilitation, which is exactly similar to MET, muscle energy techniques. But the difference is in muscle energy technique, when after resistance, when we stretch the patient, then we go back to the neutral position, while in PNF it's a little more aggressive and keeps the patient at the end of the stretch position and start the resistance at the end of that area. So it's very similar, the techniques. And then chiropractors took a PNF from physiotherapists. They used that. So PNF is basically an osteopathy technique. The same with the soft tissue therapy, mobilization technique, and so on. So as you see, the manual therapy part of physiotherapy, chiropractic, and naprapathy, they all have roots in osteopathy. However, these professions grow differently. The manual osteopathic profession did not grow well. Chiropractic did grow very well around the world because they are good in marketing. They strongly believe in marketing, and actually one of the three things that can make a chiropractor go against a disciplinary board by the regulatory colleges, one of them is that they have to do every year something to promote chiropractic. Another thing is like not to abuse patients, not to do anything wrong, and so on. But one of them is they must have every year to do something for the profession to spread chiropractic, and this is really something I admire, and I love this about chiropractic. They know that if the profession grow, all chiropractors grow, and this unfortunately lacks in the profession of manual osteopathy. Before I came into the field over 10 years ago in 2010, when I founded National Academy of Osteopathy in Toronto, Canada, Manual osteopathy was unknown in the whole world. Maybe about 30 schools offered manual osteopathy, and just a few countries had manual osteopathic care available there. So I changed that. My mission in life is to make sure every town with a population of 100,000 people have at least one manual osteopath to serve people. Manual osteopathy does amazing work for chronic pain. I want every people in every part of the world have access to this wonderful, beautiful, miraculous healthcare. It does wonders in treating chronic pain. It is like a miracle on a daily basis. We see last resort cases others cannot help. We treat them. People who have pain for many years, we help them, and that is why I do so much marketing for the profession, and that is why we have so many countries. I have alumni students in 72 countries like Nigeria, Bermuda, Iran, India, island of Macau, island of Bermuda, Barbados, so many places that they didn't have manual osteopath. Now most of the manual osteopaths there are my students. In Canada itself, most of the manual osteopaths outside the province of Quebec, they are my students. In provinces like and territories like Yukon, Northwest Territory, Prince Edward Island, Nunavut, they even until a few years ago they had no manual osteopath at all, not even one. And now because of our schools, now they all have manual osteopaths there. This is what we do. Osteopathy is beautiful, but marketing is so important, and that is why I push my students as one of the assignments at NEU and also at our universities in the US and Spain. They must publish 2 articles about osteopathy. What is osteopathy and why they chose osteopathy, because I want them to learn how to publish, how to promote osteopathy on the internet. I want the whole world know about osteopathy. See how chiropractic expanded. Just in the province of Ontario, there are 5,000 chiropractors. This is beautiful. Every person, almost in every part of the world, have access to chiropractic care, and I want this the same for osteopathy. Luckily, with my backing and with my energy, we were able to do so. Naprapathy, on the other hand, unfortunately, doesn't have a person like me, doesn't have a good marketing team. In the whole world, there are just 5 schools of osteopathy, 3 of them in the US, 2 in Europe, and out of these 5, 2 are my school. We offer a Doctor of Naprapathy program at National University of Medical Sciences in Naples, Florida, and another one at National University of Medical Sciences in Madrid, Spain. They really need somebody to start marketing. Naprapathy is an amazing profession. It does really good job in treating pain, and it's very gentle, soft. It's not aggressive. It doesn't focus on aggressive techniques, but unfortunately, it's just not so marketed well. And I don't have much time to spend on it. I really love naprapathy. I studied it myself, and I love it. It's beautiful, but my time is focused mainly on osteopathy. Maybe one day in future I can do so, but I really hope somebody come along and market it. It is not a profession regulated in a couple of states in US. But aside from that, no, like they need a good organized system to market the profession, so people can know, because these are amazing. Chiropractic is amazing, and I'm very proud that I studied chiropractic before. I learned a lot, and it's just amazing how they market themselves, how they make the people know about their services. So almost everybody in North America knows about their services. So I hope one day we have the same for manual osteopathy, and one day naprapathy be the same. Physiotherapy is obviously accepted everywhere because they became part of the main medical system. So they were controlled by medical doctors for a long time as part of their system. And still many places in the world, like Iran, for example, a doctor has to write prescription. In Canada, even up to a couple of decades ago, it was the same. And they had no right to do medical diagnosis. They couldn't see the patient directly, but luckily with lobbying and working at the parliaments in US, in Canada, they were able to get the right to do medical diagnosis and to see patients directly without the need for referral. So that's it for today. Now I hope you understood origin of this manual therapy system that originated in US. They all started with osteopathy. Osteopathy is the grandfather of all manual therapy techniques in North America, and itself osteopathy started from indigenous people's healing arts and body work, especially from Cherokee tribes and Shawnee tribes bodywork. Shawnee tribes bodywork is disappeared, but Cherokee tribes bodywork is still there, and it still is practiced by the indigenous peoples in US and Canada. And that's about it. Have a nice day. Enjoy this wonderful day. I am in Naples. I love Naples. It's a beautiful, beautiful city. That's why actually I set up the university there, even though it would have been more beneficial to register it in, for example, Nevada, which doesn't have any state tax, but Florida has a state tax. But because I wanted to keep going often, I decided to come here. And anyway, I don't think it would have been so good for me to keep going to Nevada. I would have lost all my money in casinos. No, I'm joking. I do not gamble. I totally don't understand how people gamble. For me, the idea of gambling is just not appetizing. It's not something that I ever done. It's not something I do. I focus on a healthy lifestyle. I exercise a lot. I bike. I walk. I swim, and enjoy healthy organic food. And now I started intermittent fasting. I eat once a day at 4 o'clock, which done amazing thing for me. I make other videos about that later on. But in January 2020, I lost 26 pounds, something like 12 kilos. And I went to size in my shirt and pants. I love the feeling. And the best of thing, about the intermittent fasting, what I love is that it removed this control of food that had over my life, and this peace of mind that it gives me in my mind. I feel closer to God. I feel closer to nature and the people that are around me, and I feel very calm. I feel more spiritual. If you're medically okay and your doctor allows it, I recommend you to try intermittent fasting. It does wonders for diabetes, preventing diabetes, for cardiovascular diseases. It eats all the bad things inside your body. It's one of the best detox systems that you can find. It's just amazing. I really enjoying it. I was planning to do it just for 1 week. Now it's about 2 months, and I think I will do it for a long time. I don't want to stop. I don't crave foods at all. I don't feel hungry. I feel so much energized. These videos you see started after I go through a 1 meal a day program. Before, I didn't have so much energy to do all these activities. Now I'm writing a book, I'm doing videos, I'm doing so much activities. On top of exercising, I save about 2 hours a day that I spend on shopping for food, meal preparation, and so on. I save that I can spend on the things I love to promote osteopathy. I live, I breathe osteopathy, and now I have more hours in a day to work on it. Okay, I know I went over the topics. It's not related to this topic. Forgive me for that. I just get excited sometimes. I'm in Naples. Usually I'm in Toronto. I get to talk to my students, but now here I don't have no students next to me. So you are the one that have to listen to me. That's it, and have a nice day. Enjoy this wonderful day. Until next time, bye for now.